decriminalisation as it exists for drug use and some of the different models that are in place across Europe today. So my name is Jamie Bridge. I've been asked to moderate today's event. I work for the International Drug Policy Consortium, or IDPC. I'm based in the UK, but IDPC is a global network of nearly 200 NGOs from all around the world. And decriminalisation is one of our main priority areas for the next 3 years, and one in which there's already been so much progress and momentum in different countries. And alongside the Talking Drugs platform, we've produced an online map that we've called Drug Decriminalisation Across the World. And that shows that there's around 30 countries that we found that have adopted some form of decriminalisation related to drug use. So this is growing in its size as an approach. And as an approach, it's now got explicit support from the entire UN system, from major donors such as the Global Fund, and it's also clearly permitted within the international drug control treaties. So before I hand over to our first speaker to get us started, I just a few quick announcements just for you all. We're really pleased to say that we have organised translation, and so translation is available today between English and Russian, and one of our presenters today will be presenting in Russian. So at the bottom of your screen, you should hopefully see a globe icon with interpretation written on it. So if you click on there, you can select either the English or the Russian channel today. If you have any issues, please let us know in the chat and we can try to fix those for you. This session is being recorded and it's also being broadcast on Facebook Live, just so that you're aware. We do have a lot of speakers lined up, but each speaker has been given a strict time limit. So we should have time at the end for some questions and answers from you as the attendees. So please use the Q&A function. Again, it's one of the little icons at the bottom of your screen. Please use that function to submit your questions at any time, and then we'll have some space at the end to go through those. If you have any technical issues, as I've said, please use the chat box and let us know, and my colleagues can try to help. And as always, please try to keep yourself muted and your video off while others are presenting as well, just to make sure that the sound is clear. So let's get started. Our first speaker today is Pavel Bemp, the former mayor of the city of Prague in the Czech Republic and a member of the National Drug Commission there. Pavel's also a member of the Global Commission on Drug Policy, and we're really honoured to have him here today to kick us off and to start this discussion. So with no further delay, Pavel, over to you. Thank you very much.
Good afternoon. Warm regards from sunny, lovely and positive Prague. Actually, not only as far as COVID-19 prevalence and incidence is concerned, but I'm talking about the spirit of the city. My thanks and the Global Commission thanks to Eurasian Harm Reduction Association and Correlation, to Ghana, Eliza, Eberhard, and all the staff for gathering this important event in this little bit crazy COVID time. Thanks also to audience for taking the time to come and learn more about current developments in harm reduction. I have the privilege to introduce this session on decriminalization on behalf of the Global Commission on Drug Policy, self-constituted body of currently comprises actually 14 former heads of states, presidents, prime ministers, altogether 26 leaders and influential personalities. We started the advocacy on international drug control policy reform 2010, prioritizing individual and public health, addressing HIV, hepatitis, TB, drug mortality, all caused or fed by drug prohibition and so-called war on drugs. Later, we advanced in opening an informed and science-based dialogue on decriminalization and illicit drug regulation breaking the taboo around two major unintended consequences or unintended negative consequences of punitive international drug control regimes. And this is human rights violation and stigma caused by decriminalization of people who do just a simple thing as possessing and using illicit drug with no harm to others, and the fact that the prohibition is feeding the most violent and profitable black market in the world, the one with illicit psychoactive substances. In order to dismantle that, we have to put governments into control through the legal regulation. Certainly, there are many other unintended consequences. I don't want to spend much more time on that. I need to mention over-incarceration, epidemics of HIV, hepatitis, TB, drug overdoses, but also the lack of access to pain relief medication and treatment. The punitive policies do not target or impact all parts of the society in the same way. It's the poorest and most vulnerable citizens who are apprehended and punished. This itself constitutes a breach in the rule of law, equality, and justice, and even the very fabric of society. There is no time for me to comment on the state of art of harm reduction today, but the situation is for me deeply concerning. As the situation stands today, the major sustainable development goals that concerns health and hence connected gender equality, the protection of the environment, socio-economic development, and the reduction of violence, corruption, all this will not be achieved for an important part of the population because simply of current drug policies. The spirit of criminalization and punition still is well settled at the core of drug control, and the last decade was not enough to remove this entrenched reality. We have found no evidence on the efficacy of criminalization in reducing the demand, the supply, or the so-called unintended consequences of prohibition. Rather, if the drug control regime wants to reduce the unintended consequences, it would need totally to change its strategies. The criminalization of drugs questions directly the right to privacy. For instance, Supreme Court currently in Colombia and Argentina, as well as the regulatory framework of cannabis in Washington, DC, were clear on the right of people to use drugs in their homes. Criminalization, discrimination, and stigma, as we know, can result in disastrous consequences for someone doing as simple an act as to use an illegal substance, risk, for example, of incarceration, lifelong criminal record, loss of income and livelihood, loss of marriage, child custody, poor care in the health sector, exposure to physical and psychological violence, loss of reputation, among other disastrous consequences. In contrast, well-implemented decriminalization, as we witness in countries as diverse, for example, as Portugal, Jamaica, protects human rights and addresses the drug-related harms much more efficiently. Actually, Czechia, my country, has decriminalized in the past 30 years twice. And we are happy to have one of the lowest rates of HIV infection among people who inject drugs. Certainly also one of the lowest rates of overdoses among people who use drugs. Hepatitis infection, one of the smallest heroin markets in Europe. Moreover, vulnerable populations are in contact with health and social services, so it is also crucially important. So finally, what are the recommendations? The Global Commission applauds the positive outcomes from the decriminalization policies in place, but lament that there are few examples so far. We need a new understanding of decriminalization in order to fully roll back the damage of punitive drug laws and uphold the principles of human dignity and rule of law. There must be no sanctions whatsoever for drug possession and for personal use. Many countries have passed decriminalization legislation or something like decriminalization legislation, but it has not been implemented in many countries effectively so far. Inefficient policies range from low threshold levels, corrupt institutions, or simply a lack of political will to end decriminalization of people who use illicit substances. There are many other low and non-violent actors in the drug trade beyond the one of those using for personal function. For these actors on the market for which criminalization is both unnecessary and, according to our opinion, disproportionate. Individuals engage in the drug market for a number of reasons, from economic marginalization and a lack of other opportunities to coercion. Yet criminal justice systems rarely take these factors into consideration when prosecuting low-level actors who face severe punishment, from lengthy custodial sentences, but also to the death penalty in some countries. All countries have the opportunity, following the adoption of the UNGAS 2016 outcome document, to show that drug policy is as high on their agenda as they have stated, by opening the debate with the different stakeholders to strengthen the response, and by avoiding their national drug policies become irrelevant and counterproductive, by focusing solely on law enforcement approaches. These dialogues are a first step for all government institutions to join the debate and plan a clear path towards leaving the prohibitionist paradigm behind, and to decriminalize, and also to explore regulatory models for all illicit drugs. Thank you very much for your attention.
Fantastic. Thank you so much, Pavel, for that great introduction. And I do strongly recommend you look up the Global Commission reports if you haven't already done so. Their report on decriminalization and their other reports. And it's great to hear the Global Commission advocate, similar to my organization, IDPC, for a decriminalization model that includes no sanctions for people who use drugs. I think that's a really important message to start with. So thank you very much. As I've said, there's time for questions at the end. So please do submit your questions using the Q&A option on Zoom. Our next speaker today is Maktel Bush, who is the director of Mainline, a leading harm reduction, drug policy and human rights NGO in the Netherlands. Mac's going to tell us a bit more about how the Dutch approach the issue of drug use and decriminalization. So Mac, over to you. Thank you.
Thank you, Jamie, and thanks for having me. I hope everyone can hear me and see my screen.
We can see the slides, but do you want to press slideshow? Do you want to turn it into a slideshow so it shows up
Yes, I do.
at the very top there?
Yes. Is better?
Yes, perfect. Yes,
Yep.
thank you, Mac. Thank you.
Well, hi everyone. My name is Machtel, like Jamie said, but you can call me Mac because no one can pronounce my name. I am here in the Netherlands, and I'll shortly confuse you with some of the things that are going on in the Netherlands. I think most of the audience views the Netherlands as a progressive country with a drug policy in place that's in favor of public health, and that's luckily very true. But I also want to touch on some recent developments here in the Netherlands, also to let everyone think along with how fragile the steps are that we're taking in drug policy, and how easy it is to forget why we implemented certain policies in the first place. Well, I think my presentation in the end will leave you quite confused. So hopefully others can take that up and clear the path for us. So just very briefly, I only have a very short time, but our drug policy in the Netherlands stems from the 1970s. And the aim is really specifically to control and to reduce the drug-related societal issues. Health issues, but also public safety concerns. And there's a few keywords in our drug policy, which are pragmatic, humane, realistic, and evidence-based. That sounds really good to my opinion. There's 4 pillars in our drug policy when it concerns public health. So I'm not talking about the justice side of things here, of course, but where it concerns public health, we have 4 pillars. They are still in our drug policy today. And those consist of providing people with good information, making sure that you work on prevention for young people in particular, making sure that you have evidence-based drug treatments in place, and working on harm reduction. And that's the latter thing is something that Mainline, our organization, does. The key messaging in the drug policy is very clearly that possession, trafficking, and production of drugs are illegal in the Netherlands. That's maybe contrary to what some people, mostly people outside of Europe, would think, but definitely possession also is illegal in the Netherlands. Now, the interesting thing is that the use of drugs is not illegal. So there's no penalties, no fines when you use drugs, personal consumption. 2 other elements in the law are a separation between soft drugs and hard drugs. So soft drugs, for example, cannabis. Everyone knows, of course, the coffee shops in the Netherlands. And then hard drugs, more the substances that have a larger impact on your health. So heroin, cocaine, methamphetamines, that bunch. And coffee shops, like I mentioned, they are tolerated in the Netherlands, so they're not per se legal, but they have sort of an in-between status, but they're tolerated from the perspective of public health. That raises question, there's no time for that. So how to distinguish between personal use, or I am allowed as a person to use drugs, but I'm not allowed to possess drugs. So how should I deal with this? Because if I want to use, I have to have it in my possession. So there's categories in the law for different substances that sort of distinguish how much you can have on you, where the police would still think, okay, in every reasonable thinking, this would be for personal use. For soft drugs, for example, hash or weed, that is below 5 grams. For hard drugs, it's below 1 gram. Half a gram. For ecstasy, something that is quite common in the Netherlands, a maximum 1 pill. And for GHB, I don't know if other people use that in other countries, but we do here, and that's below 5 milliliters is still seen as possession for personal use. So if you have this on you, the police may confiscate your drugs, but they won't fine you, and it won't result in a criminal record. Now, that is, of course, something that is fantastic, because all these young people that might be experimenting and that get a criminal record just because they've used drugs a few times in their lives and got caught by the police, it's of course a huge waste of young lives. So this is something that I think is very, very important indeed. And if you have larger quantities in your possession, then they will be confiscated and you might risk a penalty, of course. So then you'll see, and that will be seen as possession with intent to sell or drug dealing. Now, to confuse you a bit more, the Netherlands has some quite topical debates around drugs at the moment. So we have the honor of being one of the main producers of ecstasy and cannabis in the world. Crystal meth is now also in our portfolio. We're getting pretty good at that as well. We are an extremely important hub for the cocaine trades and the heroin trades through our harbors in Rotterdam, for example, and moving that into Europe. And also we have a lot of big players in the sort of the dark web scene, where of course a lot of drugs are also sold. So the Dutch have a bit of a problem with drugs on the production side of things, the trade sides, and of course that leads to very, very big societal debates, and our drug policy is actually under pressure. A recent report, for example, and that was released by a pretty high-end think tank. It's a really good report on the drug-related crime, and it's very nuanced. But when it comes to harm reduction, they literally take a causal line saying that because of the Dutch focus on harm reduction, we lost sight of organized crime. So I think it's extremely worrying that high-end people make such simplified conclusions and disregard, for example, the schizophrenic situation with our coffee shop system, which I think, because we never fully regulated, led to a lot of problems. But this is now, impacting harm reduction. So I think that's a big concern. I think also the debate on regulation has really faded to the background, of course, also due to Corona. But before, it was a debate because of all the production issues in the Netherlands. And just to show, this is my final slide, just to show some of the confusion, and I think also people listening in might be slightly confused with our drug policies. But our own minister is also getting quite confused. So one of these fine gentlemen that you see here is our Minister of Justice. The audience may guess which one of them. He says that the use of soft drugs may lead civilians to not abide by the Corona rules that are instated in recent months. Quite a big claim. I don't know about you guys, but if I'm stoned, I'm usually sitting at home, so it's actually quite good for our quarantine. No, just kidding. But it's a pretty big statement, and it has consequences as well. So recently, a motion was accepted in Dutch Parliament to actually allow law enforcement to fine and penalize people who use soft drugs at night, so after 11 at night until 7 in the morning. And this motion, there is a majority in Parliament for this. Now, this is exactly something that is in that gray area of where do we make the distinction between personal use and possession, and how can we make sure that we safeguard the things that are in our law and make sure that they're not forgotten just by topical debates that are not going into the detail of why our law is as it is. I think I'll leave it with that. I think the final quote that is really worrisome from our Minister of Justice is the latter one. I can't read because my Zoom is in it, but it basically says the possession of soft drugs is technically illegal anyway. So therefore also is use. And this is a claim, this is a quote from our Minister of Justice, just flagging how confusing the law is, but also how confused our own minister is with how to implement these laws and how to protect users. So I'll leave it with this, also because of time, and I'm very curious to hear how other countries deal with these issues.
Excellent, thank you so much, Mette. I really appreciate that overview. And yeah, it's the Netherlands is a confusing model at times, and I think it'd be good to hear people's questions about that, and particularly maybe something we can pick up later in the discussion is the impact of COVID on the drug policy in the Netherlands as well. Okay, we'll move straight on to our next speaker though. Our next speaker is Sasha Gurinova from Germany. Sasha was born in Siberia and previously worked for the Russian Harm Reduction Network before moving to Germany in 2009. Sasha now works for the German AIDS Help or AIDS Hilfe Association, focusing mostly on women who use drugs and on drug policy work. So Sasha, the floor is yours. Thank you.
Thank you. Thanks for inviting me. I will show you my presentation. I prepared a couple of slides, will not PowerPoint you to this. So I was actually asked to talk about German progressive drug policy and to talk about examples how there are no consequences for possessing drugs in Germany. I have to disappoint you because there are consequences, and drug policy is not that progressive. First, there are a couple of fresh numbers from the German Federal Crime Police Office. And it says that in 2019, there are 360 almost drug-related offenses registered, which is 2.5% more than in 2018, and 1,398 drug-related deaths, which is almost 10% more than in previous year. 53,375 drug trafficking offenses. And this number stayed almost the same compared to 2018. So if you look at these numbers closely, out of those almost 360,000 people and cases, 284,606 are consumer-related offenses. And only, you see, this is the highest column. And it's 3.6% more than in previous year, which is quite a lot. The number of trafficking offenses remain almost unchanged compared to 2018. Other offenses, you can see this, the little light blue column, like production, it's even decreased in 3.5% compared to 2018. Now, if you see at these numbers, then the far largest drug law offenses recorded in Germany in 2019 are in connection with cannabis. It means that mostly young people who are caught buying cannabis or just trying or just occasionally using are in this statistic, in this number, and this has dramatic consequences. We just heard that in Netherlands, there is a principle where police can decide whether to proceed further or not. In Germany, we have this so-called legality principle. So if once stopped by police on the street, search and there are drugs found, a criminal complaint must be filed. So police cannot decide to just take the drugs and let the person go. And I also wanted to show how this legality principle in Germany works. So the person is checked on the street by police, drugs found. Police have to make a criminal complaint. Criminal complaint filed, and on the spot, police can also decide to go right away to the person's house and search for more. And in Germany, I must say, in Germany, there's only one place where drug possessing is allowed. It's drug consumption rooms. No other place, no streets, no parks, like some people think that some parks in Berlin are tolerating drug possession. No. Third step, police forward the complaint to the state prosecutor, and the prosecutor will decide whether to investigate further or not. And this depends on the quality, on the substance, on the age of the person, and some other things. In 60%, there is no proceeding on the case, 60%, and around 40% will go to the court. Out of this 40%, around 4% will go to prison. Others will need to pay fine or do some social work on the streets or so on. And 1/3 of all prisoners in Germany are there in prisons for drug-related offenses. But that's why, and of course, police in Germany also sees that this doesn't work effective. So that's why there are a lot of discussions in Germany about alternatives to this current drug policy. And I also want to get back to this appeal that there are no consequences for possessing drugs. There are consequences, even those 60% who will be let go. This information will stay in their criminal record, and it will affect their work situation, their studies, their driving license. And also there is a lot of stigma because, for example, in cases when police decides to go and search the home of the people, then the neighbor sees that there are police coming and the parents sees it. So it's, I wouldn't I would definitely say that there are consequences, even in Berlin, for possessing drugs and drug-related offenses. Thank you very much.
Thank you. And yeah, okay, so very interesting example, very different from some of the other models we'll hear of today, but still one where, as you say, sanctions are still there for people. And yeah, thank you very much for sharing. Our next speaker, we're going to head northeast from Germany and go towards Estonia. Our next speaker is Mart Calvet, who's a leading drug policy reform advocate from Tallinn. Mart has served as a board member for LUNEST, which is the Estonian Association of People Who Use Drugs, and has also worked in the country's diversion from arrest program. So Mart's going to tell us a bit more about what is happening in Estonia. So over to you, Mart. Thank you. And let me know if you need me to share your slides, Mart, or if you're able to do it yourself.
Hello, let's see. I think I can figure it out myself. Can you see my slides?
I can't, no, not yet. Do you want me to share them from my screen?
What are you seeing?
At the moment, nothing.
At the moment, nothing.
Yeah.
Weird. I'm trying to share my screen, but apparently it's not working. So if you could.
Yeah, okay, that's no problem at all. Let me just open them up very quickly for you. And then, yeah.
Sorry for the delay.
No, don't worry at all. Okay, and hopefully, hopefully that's now worked for people. So over to you, Mark. Thank you.
Wonderful. Thank you very much. And I'm as Jamie said, I'm representative of Estonian Drug Users Union, as well as a support person in a diversion from arrest program. And I'm going to talk about the situation in Estonia. Can you please change the slide? I'm also co-founder of a club drug harm reduction company and a member of the Estonian Medical Cannabis Association, but I don't think that's going to come into today's presentation very much. Slide, please. Jamie, can you? Thank you. Very short description of the drug laws situation in Estonia. Use and possession of small amounts has been decriminalized since 2005. In practice, this means that if you're caught by the police with a small amount, you will not receive a criminal penalty. The small amount is defined in a very weird way, as enough to intoxicate at least 10 average citizens, average people. Supply and production, of course, still remain criminal offenses. Possession of a small amounts is punishable by fine of up to 1,200 euros or up to 30 days of arrest. I think we're one of the, we probably are the only country in EU who that still uses arrest as punishment for non-criminal penalties. But this is not done very often. If a person can't pay the fine, then they can get arrested and be held up to 30 days. There are alternatives to punishment, but they are not applied very systematically, in my opinion. And also, in my opinion, the law discriminates against people with opioid addiction, because let's say a heavily dependent person may use more in a day that is considered a small amount. So in effect, the law is incentivizing people with heavy opioid addiction to go to the dealer daily or even several times a day, which is probably not an intended point of the law. But, slide, please. So these are the main unwanted consequences of Estonian drug laws that were true before COVID and are true now after the lockdown. Big busts are usually followed by influx of novel substances. For example, if a fentanyl lab is taken down or a fentanyl network is taken down, up crops a 3-methylfentanyl network. And if that one is taken down, new dealers will come up with new substances like carfentanil or isotonitazene. Crypto web sales usually increase after these busts because people feel safer buying from the web. Drug screens become unreliable, which can be a problem if you're using a substance that does not show up in any of the official drug screens, but you want to, for example, join the opioid substitution program. This has been somewhat corrected by now, since we're having big problems with isotonitazene, which is hard to detect. Traditional substances are mixed with or sold as new psychoactive substances. We've seen that in Estonia with alpha PDP, so-called flaka, has been found in amphetamine or sold as amphetamine. And also home brewing of contaminated substances. People from the Eastern Bloc know what I'm talking about when I say vint, which is basically methamphetamine made on in home conditions out of over-the-counter medicines, and usually contain lots of stuff that you don't really want to inject, like metals and other impurities. Slide, please. I'm going to talk about some numbers because my time is running out. There are two alternatives to coercive sanction programs, diversion from arrest programs in Estonia, VALIK and SÜTIK. VALIK is a program for people who have cannabis issues, and SÜTIK is for people who have dependency issues with anything other than alcohol and cannabis. The number of clients you can see on the slide, VALIK has had in 2 years 170 clients. Only 43 have been sent by police, and there are 60 or so are currently active now. SÜTIK currently has 356 clients in 2 regions, and only about 10% have been sent by the police or by parole officer or ordered by court. And the number of drug misdemeanors has reduced since 2018. You can see the numbers by more than 40% in 2 years, but the number of drug crimes has remained stable at about 1,500 yearly. Slide, please. So, based on my experience and opinions, does decriminalization work in Estonia? Has it been a success? In some sense, yes. Alternatives to coercive sanctions exist. They are available. They are recognized by state bodies, and the number of registered drug misdemeanors has decreased since the initiation of these diversion from arrest programs. In another sense, not very much, because drug use and drug-related harms are still prevalent, and the number of registered drug crimes hasn't decreased. And of course, we all know it's really impossible to tell because we have no control groups. There are no other countries that did not decriminalize, or you know what I mean. In conclusion, I would say that decriminalization alone is definitely not a silver bullet, but even if done sloppily, if done wrong, it can still be better than no decriminalization at all. I think that's it from me.
Excellent. Thank you so much, Mart. Appreciate you explaining the situation, man. I really take home your message that this is not a silver bullet. This doesn't fix every problem that exists, but with all the different models out there. It's been really interesting to see the positives and the negatives of different experiences across the region, and we can discuss those a bit more at the end. So,
thank you.
Yeah, thanks again, Mark. So our next speaker on our agenda is Erkinbek Iriskulbekov, a lawyer and expert from Kyrgyzstan. So we're really pleased to have you with us, Erkin. Erkin is currently a mentor in the Global Fund project called Overcoming Legal Barriers, which provides legal assistance and support to people who use drugs, amongst other people. Erkin will be presenting today in Russian. So a quick reminder for those who may have missed the start of the session. If you want to follow this presentation in English, please select the English channel using the globe icon at the bottom of the screen, which is for the interpretation. So yeah, and if you have any issues, please let us know in the chat. So over to you, Erkin. Thank you very much.
Всем привет, уважаемые участники. Еще раз представлюсь. Меня зовут Эркин, я из Кыргызстана. И в своей сессии я хочу вам рассказать о реформе, которая у нас прошла в прошлом году. Вот. Ну, точнее, о последствиях этой реформы. Вот. Когда мы слышим слово «реформа», мы ожидаем какие-либо улучшения. Вот. Но на практике, оказывается, это не всегда так бывает. Вот. Отрицательные моменты. Вот. Сейчас я попрошу организаторов мне помочь. Вот. Да, вы уже подключили слайд. Так. Можете ли, пожалуйста, переключить?
Эркин, я думаю, что вы сам можете все переключать, вы сам все делаете сейчас.
Да, все, спасибо. То я этот... Ага, попробовал, не получилось. Ага, всем ли видно, да, слайд?
Да, все видно.
Ага, спасибо. У нас с января прошлого года, в 2019 году, вот, в рамках судебно-правовой реформы вступили новые кодексы и законы. Вот. О всех законах я не буду говорить, только лишь затрону ту часть, которая нас интересует, то есть это наркополитика. Вот. В рамках этой реформы были внесены ряд изменений и дополнений вот, в наши нормативные акты вот, в сфере наркополитики. Вот. И правоприменительная практика показывает, что введенная реформа вот, имеет как положительные, но так и негативные стороны. Так, у меня не получается переключить.
Эркин, я очень извиняюсь. Джейми вам помогает переключать все-таки ваши слайды, вот он проинформировал меня. Так что вы говорите хорошо, когда переключать, он будет вам переключать.
Ага, спасибо. Вот. Что у нас изменилось? В первую очередь у нас очень сильно были повышены штрафы. В самом начале я хочу дать понятие, что у нас есть уголовная ответственность, да, за преступления в сфере наркотиков, это за хранение и за приобретение. Вот. И также есть у нас, скажем, менее ответственность за уголовное, это административная ответственность. Вот. Предусматривается только штраф. Вот. Если вот вы видите в слайде, по административной ответственности у нас в 60 раз увеличился это минимальный штраф. Вот. А максимальный штраф он вырос в 30 раз. По уголовным делам минимальный штраф он вырос в 9 раз, а максимальный это в 4,5 раза. Вот. Помимо штрафа у нас также предусмотрена мера наказания в виде лишения свободы сроком от 2,5 до 5 лет с выплатой штрафа. То есть помимо того, что человека сажают в тюрьму, вот, также на него налагается штраф вот, в размере я сразу перевел в евро, чтобы вам было более удобно представить. Это 1300 евро, это минимальный штраф, а максимальный это где-то 800 евро. Можно, пожалуйста, следующий слайд? Здесь вы можете наглядно увидеть, как штрафы у нас значительно выросли. Вот, синим цветом это штрафы, которые были раньше. Вот, в диаграмме номер 1 это преступления в сфере административного характера. Да? То есть это от 7 евро оно выросло до 390 евро. Вот. А максимальный штраф от 26 евро он вырос до почти 800 евро. Вот. По уголовным делам, это диаграмма номер 2, минимальный штраф от 26 евро он вырос 234 евро. 2340 евро, прошу прощения. А максимальный штраф от 650 евро он вырос в 2860 евро. Можно, пожалуйста, следующий слайд? Здесь хотелось бы отметить, что высокие штрафы они стали просто-напросто неподъемными, да, для людей с наркотической зависимостью. Вот. Как правило, такие люди работают, вот, и их работа не является постоянной. Вот. Учитывая тот фактор, что у нас в Кыргызстане средний квалифицированного работника это составляет 200 евро, вот, а минимальная гарантированная заработная плата квалифицированного работника она составляет 23 евро. Вот. То есть, если эти данные по штрафам, вот, то вы понимаете, то, что эти штрафы они стали просто-напросто неподъемными для этих людей. И бремя выплаты, вот, они легли на плечи родных родственников. Однако эти сюрпризы у нас не ограничились, вот, и у нас ввели еще такую норму, что эти назначенные штрафы в случае невыплаты своевременно, они увеличиваются. Увеличиваются в 2 раза, то есть в случае, скажем, например, по административным делам дается 3 месяца для выплаты этих штрафов. Если в течение 3 месяцев человек не выплачивает, то начинает расти пеня. Вот, и оно растет до той суммы, скажем, по минимальному штрафу, да, до, скажем, 60 тысяч сомов. Это вот по национальной валюте. Можно следующий слайд? Вот. В случае неуплаты штрафа в срок, вот, ранее назначенные штрафы, они могут быть судом заменены на лишение свободы, вот, в пределах установленной санкции. Вот. То есть здесь мы говорим о том, что законодатель, он в любом случае подталкивает человека на лишение свободы. Вот. То есть мы с вами убедились, что человек, если в силу определенных факторов не может выплатить штраф в назначенное время, вот, то в любом случае конечная цель или конечный результат будет заключение его под стражей. Вот, в сроках по административным делам это до 2,5 лет, вот, а по уголовным делам это в зависимости от тяжести преступления. Вот, но средний срок наказания у нас предусмотрен от 2,5 до 5 лет. Вот. Это отрицательные стороны нашей реформы. Вот. А о положительных я скажу буквально в 2 словах. Вот у нас был отменен институт рецидива преступления. То есть, если человек ранее совершал, скажем, преступление по наркотикам 2 и более раза, вот, то к нему применялся рецидив. Вот. Что это значит? Рецидив, он является более сложным, вот, и срок наказания там было от 7 до 12 лет. Также у нас сейчас при изъятии наркотиков рассматривается чистый вес наркотика. Раньше эта практика была у нас, когда полицейские изымали наркотики, они взвешивали и не разбирались, есть ли какие-либо примеси в этом наркотике, да? То есть прекурсоры, может быть, димедрол и так далее. Сейчас у нас рассматривается только чистый вес наркотика. Следующее новшество положительное, это вот по административным делам. Раньше была альтернатива, то есть вместо штрафа они могли назначать заключение под стражу до 5 суток. Вот. Сейчас эту норму убрали, вот, и также убрали судимость о том, что по административным делам у нас, то есть сейчас по проступкам человек считается несудимым. Вот. У меня все. Вот. Благодарю за внимание. Если будут вопросы, то с удовольствием постараюсь ответить.
Excellent. Thank you so much, Kin, and apologies for the confusion with the slides, but I'm really glad that worked. And yeah, fascinating. Another fascinating example of what this looks like on the ground in Kyrgyzstan. And yeah, I had no idea about the level of those fines. It's incredible, and I'm sure we'll discuss that a bit more at the end as well. So yeah, once again, thank you very much, and we'll move on to our next speaker, who is also our host, who is Eliza Kirchevich, who's Senior Policy Officer at the Eurasian Harm Reduction Association, which is based in Lithuania, but obviously covers the entire EHRA region. Eliza has a master's degree in international law, and her work focuses on drug policy in the region. But today she's going to tell us more about policy in Lithuania itself and what's been happening recently in Lithuania. So over to you, Eliza. Thank you.
Thank you very much, Amy, and thank you for everybody who is today with us on this session. So previous experiences, to be honest, were kind of like nice ones comparing with Lithuania's, because now I will present kind of like the extreme example, an extreme case when we have a criminalization. However, some of the even government members, they think that still we are kind of applying, you know, decriminalization. So Lithuania case, until 2017, we had for the possession of drugs in small quantities, so it's basically for your personal use, we had administrative liability. However, government changed, like parliament changed, and of course the laws changed with this. So from 2017, we are back to the criminalization of any quantity of the psychoactive substances. So at the moment, what we have in Lithuania is possession of drugs without intent to distribute it, as well as with intent to distribute, like to share, supply, whatever, is a criminal offense. And yeah, of course, there are also like a scales on which it depends like what sanction you will receive. So the second slide is about actually like what fines are applied in cases of possession of different amounts of drugs for personal use, so without intent to distribute. So if it's a small amount, there is like a community service or a restriction of liberty or a fine or an arrest. So all this sounds like, okay, but we are not putting a person to prison. So it doesn't sound so like harsh or like punitive or repressive, right? So this is how like our government members sometimes discussing and thinking, but this is like, okay, but never, nobody is never questioning the thing about conviction about criminal responsibility which a person receives as soon as she or he like does this crime. Then for large amounts, we have imprisonment up to 2 years, and for very large amounts, we have imprisonment from 10 to 15 years. So this is all when we speak only about possession without intent to distribute. If we would speak about possession with intent to distribute, to share, so it's counted as a supply, we are speaking even about imprisonment up to 15 years. And it's an interesting thing how our courts are interpreting what is intent to distribute. So for example, if I'm sharing a joint with my colleague, so if I'm just like giving, you know, it to somebody, sharing, so they already interpret it as an act of distributing, sharing with somebody and with intention to do it. So basically in that case, my crime will be qualified not according possession of small amounts without intent to distribute, but it will be counted as a crime of supply. So in that case, if it's a small amount, I can receive from 2 up to 8 years imprisonment here in Lithuania. Here is just like a statistic, basically just to show what is the situation, like comparison of situation from 2017 when we got this criminalization issues here in Lithuania. So it's a number of convicted persons for possession of psychoactive substances with and without intent to distribute. So as you see, each year the number of inmates who committed drug-related offenses is growing. So if in 2017 it was 13%, and last year we have already 15%, and in the end of this year I'm pretty sure we will have more, because we have loads of these cases in the media where public is discussing like is it right or not, like to put people for such offenses. So as you see, in 2018 we had loads of people who got real imprisonment sentence for possession without the purpose to distribute. So it's almost 200 people receive an imprisonment sentence with for the crime related with drugs without intent to distribute it. This slide is about one very famous case in Lithuania. It was last year when police found at the guy's home 0.006 gram of cannabis in the leftovers of cigarette. And basically that guy got a criminal responsibility. But as you see, it's like a very small amount. So he got just 6 months of restriction of liberty and 50 hours of community services, because it was like a small amount and real imprisonment would be like too repressive and too harsh. But again, nobody was questioning about criminal responsibility as a conviction itself, because in Lithuania, conviction, like when you receive a conviction, it is for 3 or even 8 years. It could be up to 8 years. And basically this 3 or 8 years, and even after that, you can't, for example, to become a student of law, to become a prosecutor, to, I know, go and work in the police or in other things. As well, you can't travel actually to some of the countries to get visas, etc. So you are kind of without part of your rights to do some things just because of this small offense. And one more interesting case is that nowadays, probably you know that loads of people and loads of young people, they are sending some drugs online, like they are just buying online and then sending by post. So even for 1 pill of MDMA, which is sent by post, you can be imprisoned from 2 up to 10 years, because this is counted as a trafficking, because you are sending your drugs via borders, and basically this is a drug trafficking. So drug trafficking, it's a different article in our criminal code, and a person can get from 3 up to 10 years of imprisonment. However, our judges and prosecutors are nice people, and they think, oh, this young person, like it was first time they did it, like they're so young, they're so innocent, like let's do something, let's help them. So instead of just advocating for changes of laws itself, they're always doing some exceptions from the already existing articles in our criminal codes. So there is one article, number 54 in the criminal code, which is saying that if the imposition of the punishment would be clearly contrary to the principle of justice, as well like proportionality, the court may, in accordance with the purpose of the punishment, impose a lesser punishment. So basically, in loads of cases when small amounts are included of drug trafficking via borders, court is always applying this rule. So instead of applying it as exception, court is applying as a rule, and basically this is like a practice. So what I want to say is, like, now we are kind of discussing and probably need to discuss and debate on two things. Possession of drugs without intent to distribute is a criminal offense and punished by community service, arrest, fine, etc. So why not to decriminalize possession of small amounts instead of giving a person a criminal responsibility for it? And second thing is that this exception, you know, like in the article, it is applied as a rule in the most of cases when drugs are trafficked. So why not to make it a rule instead of exception? Just make it a rule and not like punish people. But yeah, and for the end, I know that I don't have much time. I want to say that now Lithuania was electing new parliament members, and we have kind of new parliament at the moment, and we have a huge promises as well. Former EHRA director Morgana, she also became a parliament member, and she's like really moving forward and will be moving, I hope so, forward this decriminalization laws. So I hope that next year when we will meet in some of the conferences, I will be very happy and honored to say that we have a decriminalization. So fingers crossed, hopefully it will happen. And thank you very much.
That's excellent. Thank you so much, Eliza. Yeah, we're very excited to hear the news from your election in Lithuania. And congratulations to Morgana. I don't know if she's on this webinar or not, but congratulations anyway. Okay, our final speaker on the platform today is Zanat Kosmicomedova, who is with the United Nations Office of Drugs and Crime. I hope I pronounced that even close to being correct, but apologies if not, Zanat. Zanat is the head of the Regional Programme Office for Eastern Europe and is a global focal point for the UN on law enforcement and HIV. And Zanat's going to present to us today on UNODC's work in this area, you know, focusing on alternative measures to imprisonment. So over to you, Zanat. Thank you very much.
Thank you very much, Jamie, and thank you very much, especially thanks for very rightly pronunciation of my difficult family name. Thank you. And thank you very much for the organizers of this event, and thank you for the invitation. And really pity that due to the current situation, we cannot meet up, not virtually, but face-to-face, because we had huge plan for this conference and would like to have the pre-conference consultation to bring law enforcement and justice people to discuss the decriminalization issue, which is actually quite important for the whole region of Eastern Europe and Central Asia. And listening all previous presentation, thank you very much for very interesting presentation. I sort of understand that my general presentation at what and the areas what UNODC is doing, it's quite, yeah, probably useful, but probably not so, how to say, interesting. I would go through very quickly through the slides, and would like just to come back at the end to some discussions which we currently actually recently had. We had the global focus group discussion on law enforcement and justice response within the ongoing process of development of UNAID strategy. And this is really interesting. It was really interesting exercise. It was a quite intensive brainstorming discussion, and I would like just to raise a few points which came out from this discussion, and also probably to give you very brief information about what is going on in Belarus and Ukraine and Moldova. Probably in Moldova, our colleagues from our counterparts from the country will be more relevant to talk about this. But yeah, let's start. So first, next slide, please. Thank you. So you know that in the UNAIDS family, we're leading agency, convening agency for two areas: people who use drugs, people in prison settings. We know how to decrease the overall sort of epidemiological situation globally, how we know what to do, what works, what is the evidence-based approach. All is good, but still we have still disproportional growing cases, new cases of HIV among key population. And we are not talking only about our groups, like people who use drugs and people in prison settings. We're talking about all key population groups, and up to 62%, again, sort of new numbers of growing new numbers of HIV cases among this key population group and their sexual partners. Why it happens, and actually we're discussing why it happens in punitive laws and harmful practices, and also the decriminalization problem matters and main, how to say, important point to be discussed. This as a main barrier for effective response to HIV, to HIV prevention globally and in each country particularly. Next slide, please. Yes, so with this, of course, as logically would be talk about high imprisonment rate, which comes to the cases with drug-related crimes, which refers actually to possession for personal consumption and drug trafficking, of course, and offense related to drug possession comprises up to more than 80% of all total drug-related offenses. And we know what is going in the prisons, why it's very unfavorable conditions for the health of the people who are living there, why we have huge rate of HIV, hepatitis C, and tuberculosis, and actually which are the reason of the most death cases in prison. Thank you. Next slide, please. So what is stopping us? Because we have all the rational basis to introduce alternatives to punishment. It's highlighted in the International Drug Control Conventions. It does not prevent, it's obviously does not prevent the drug use, which was actually the primary purpose of this penalty. Also, it's always disproportionate when it comes to minor drug offenses. It's expensive and causes harm, and actually treatment, social integration, and other services reduce both drug use and drug-related crime. Next slide, please. So and it's already highlighted here by our esteemed presenter, first presenter from Czech Republic. The whole society, global society, already came up with the idea that the balance and the effective response, this is the proportional drug policy, which should be evidence-based, which should be based on respect of human rights, and that should address diverse health consequences. The last on gas, not last, 2016 on gas clearly highlighted the importance of introduction of alternatives issues. Besides that, UN position paper on drug policy also promotes alternatives to conviction and punishment. So we have all political power in our hands. Next slide, please. Also, having UNODC having such mandate and this very efficient long-term collaboration with all law enforcement sector, of course, we are natural partners to deal with them and to push the proportional drug policy issues in partnership with other UN agencies, or also with other UN, with other national partners. And since 2013, we developed some strategy, and actually which particularly focused on sensitizing and capacity building activities towards police and law enforcement and justice sector. And we've done a lot of this capacity building session with strengthening partnership, like these diversionary referral schemes, which still has some pilot basis in the countries. We developed some national curriculum on police, and which is functioning or not functioning in some of the countries. For example, in Thailand, it's actually formally exists, but it's not functioning. It's practicing in Moldova and in Kyrgyzstan, as I know, in Vietnam, in Ukraine, due to different political issues. We have to again refocus our push this again this development or update international curriculum and so on. So we are developing these activities not only in Eastern Europe, Central Asian countries. We have 24 high priority countries where we focus our efforts. So we are dealing with these issues sort of intensively in these countries. Next slide, please. We have these tools which developed in 2014. We had the training model for law enforcement, particularly dedicated for police academies, in order to sustain this approach and equip the law enforcement with the capacity and skills how to build a partnership with civil society organization in provision of HIV prevention services. Next year, in 2015, we developed the practical guide for civil society organizations in order to empower them with some skills how to improve and develop this collaboration with the police in different levels. Besides that, based on these tools we developed, it's finalized. It's took quite a lot. We finalized e-learning course. It will be launched very soon, hopefully for law enforcement on harm reduction services, so which will be easily acceptable, and actually we would like to advocate it to put in this curriculum on job training in each of the country. We have many other tools. Next slide, please. Which, sort of targeting these alternatives, targeting the judges, targeting the probation system. So all these tools are developed on some good cases, best cases, and collaborative approaches with the national member states, and to develop evidence-based and human right-based approaches, how to put alternatives in place. Now, saying that this is the end of my presentation, I would like just to come back again, as I said, on 3rd of November, we had this global focus group discussion where we sort of we were leading this focus group discussion as UNODC, and invited justice sector, law enforcement sector, and key representative of key population groups and CSOs to discuss the issues of punitive laws and harmful practices. And actually, we were not targeting only our key population groups, we targeted all key population groups, and the main cross-cutting issues was the legislation which criminalized the behavior of key population groups. And it was a really interesting discussion about what was the outcomes of this when we had 3 working groups there. Key population and civil society discussed separately, law enforcement discussed separately, and justice discussed separately. So we had 3 separate discussions, and the purpose of this was to develop some recommendation which will be included in the UNAID strategy. Why do we did it separately? Because we would like just to give the opportunity to talk honestly, openly about their concerns, to avoid any confrontation between different stakeholders, I would say. And I was part of this law enforcement group. And what did I hear? First of all, they said that it was the first time when law enforcement sector was involved in the development of HIV strategy. We're always talking about partnership, and we're talking about that law enforcement do not understand their role, and they do not want, and they only sort of focus on this punitive approach and all of this. But what have been done by us just to develop this partnership and to bring them actually more deeper, to bring them on the regular basis, because capacity building session is good. Sensitizing event is always good. But what is done on the substantive sort of basis approach, because we need to regularly to come back to these issues and to highlight this issue in their daily practices and to put this sustained in the legislation framework. And when we're talking about decriminalization, actually, we found quite level of understanding among law enforcement agencies. But what did they say? They say that it's very, how would say, it is a relevant point as well as an alternative to incarceration. But in many countries, it brings some negative connotation among law enforcement in general population. It means sometimes they confuse the terminology. What does decriminalization and what does legalization means? That is why sort of, as we understand, we should go more closely with the governmental people with the with the law enforcement sector to discuss the issue more deeply. Advocacy, we've done some advocacy for Belarus, for Ukraine, for Moldova. We brought these people to Czech Republic, to Germany, to Austria, to Portugal, to see the drug policy issues. Is it enough? I don't think so. So I think it would be good just to think from this point of view how to involve them, to engage them more prominently in the AIDS response, how make them really meaningful partners for us in these efforts. We are developing now the drug strategy in Ukraine. The issue of personal possession dosage, it's quite acute here, and we're still fighting with this. We are developing the drug policy assessment in Belarus with the recommendation. It's international and national run exercise. We're developing recommendation for the next step of the next sort of to improve the drug policy there. So we're doing all our efforts, but I think we should put more I think focus and thought how to engage them more properly and how to increase this, probably to empower the platform where civil society, key population group could openly discuss with the law enforcement and justice sector the concerns and try to find the solution for all of these problems. So that's it. Thank you.
Thank you so much, Zana. Really appreciate it. And it's great to hear about that focus group engaging with law enforcement. And I think with the UNA strategy more broadly, I think there's a lot of high hopes that is going to be quite strong on its calls for decriminalisation as well. So we'll have to wait and see how that unfolds. So thank you once again to all of our speakers. We really appreciate you keeping the time, and it's allowed us now around kind of 30 minutes or so to have some questions from the participants, which is really, really great and really welcome. Please do submit your questions using the Q&A option, and we'll try to get round to them. We already have quite a few, which is great. So, I mean, we've heard some really interesting examples from different countries on what the policies currently look like. And, you know, you will have already seen there's a huge variation, and there's lots of other models that exist as well. And we haven't even talked much about Norway, which is developing their model now, or Portugal, or any of the others that exist. As I said at the start, there's around 30 countries have some form of decriminalisation in place. But interestingly today, you know, one of the take-homes I've had is that none of those models really fit that comfortably with the model that Pavel put forward at the very start. You know, the idea of there being no sanctions. And maybe that's something in our advocacy that we have to step up. We have to do more to be advocating not just for decriminalisation, but actually for no sanctions to be placed on people who use drugs. So what I want to do is first of all, we've got a couple of questions which are directed to Mart in Estonia. So hopefully, Mart, if you're there, you can answer these now. I'll just read them out, just so I think it's the easiest thing to do. So the first question is whether or not you could explain a bit more about the VALIC and SUTIC programs. Apologies if I've pronounced those badly. But in particular, how do they ensure that they're not coercive models, and you know, as compared to something like compulsory treatment? And the second question is around NPS, new psychoactive substances in Estonia. Has there been an increase in the use of those, and how are they reflected in that table of dosages in terms of the decriminalisation approach? Because there's such a big spectrum of different substances that we count as NPS. So how can they be accounted for in that way? So yeah, over to you, Mark. Thank you.
To answer the first question, the VALIC program is based on the SPIRT model, screening, brief intervention, and referral to treatment. It means in practice that the person who thinks that they have a problem with cannabis, or whom have been directed by the police to participate in the program as a means of not avoiding the misdemeanor charges. They can go and do the program. It consists of 1 to 5 interviews with a psychologist, who then if the psychologist decides that the person actually doesn't have a problem, then they only meet once and the program is completed. If they see need for more interventions, then there are more meetings, up to 5. And if after that the psychologist decides that the patient actually needs psychiatric help or some other form of treatment, then they are referred to that kind of treatment. SUTIC is a support person program. Support persons are peers, either non-problematic users like me, or people who have had drug dependency issues in the past, and have used drugs in the past, and have are no longer using, but know very well the scene, and can offer peer-to-peer help. We basically direct these clients to other services if they need them. We make a risk assessment based on an interview with the client, and in that sense, it's the same as VALIC, only we are not trained psychologists, we are peers. How is it guaranteed that it's not coercive? For people charged in drug crimes, it actually is coercive. If they are sent to the program by court's order, then they are sort of then it's compulsory. But it's non-coercive for people with misdemeanors. But we are working closely together with parole officers, and if the person is also in a parole program, then yes, it's less anonymous, because we have to report to their parole officer if the parole officer demands it, and then it can't be anonymous and fully voluntary. But for those who join on their own, there are no coercions at all, and for those who are sent for misdemeanors, not drug crimes. And the other question was about NPS. Yes, Estonia has always been a sort of proving ground, a training polygon for NPSs. Fentanyl itself is a novel psychoactive substance, or at least it was back in 2000 when we were first hit with this substance, when it appeared in the Estonian market. And currently, yes, when I say alpha PVP, then well, it was probably 60 to 80% true a month ago. What currently is on the market, nobody really knows. There may be alpha PVP derivatives and analogs and structural analogs. There may be meow meow and other NPSs, piperazines, and so on. The people who are interested in trying them out can make assumptions based on, you know, testing them on themselves, basically, and distributing the information to peers, that what this is like, what this does, what this may be, but nobody really knows. So yeah, in both I mean, we don't really have a heroin market. We only have new psychoactive opioids, like isotonitrosen is replacing fentanyls. Fentanyls replaced heroin a long time ago. Sometimes heroin appears in the Estonian market, but it's usually short-lived. I guess that's about it.
Okay, thank you very much, Mark. That was great. I appreciate that. So the next question we have is actually more open to all of the panelists, and it'd also be great to hear, Pavel, about the Czech experience here as well. Basically, I mean, how has COVID-19, in what ways has that impacted the drug policies in those countries? And I know, I mean, Mac, if we could maybe start with you and start with the Netherlands, because at the end of your presentation, you mentioned that there's been a new motion put forward, which seems to undermine the kind of the main spirit of the policy that was in place initially. So, I mean, is that just, you know, to get us started, is that a temporary motion, like just linked to COVID-19, or is there a risk that there's actually going to be a permanent damage to the policy because of what's happened in the last few months?
Actually, Jamie, I'm not completely sure, because there's still doubt whether it fits the law. So like I said, there's a lot of confusion around this, and there's already been some contests against this like, yeah, but is this impossible under the law? So that is still a discussion as far as I know, but I don't know the current status, to be honest. This is a sentiment that is definitely there, but luckily we've also seen a very positive response in the COVID lockdown period. So harm reduction services have really been safeguarded, and luckily there's also a very positive response there. So it's not all bad, but it's concerning that a majority in Parliament adopts such a motion. It's unprecedented in the Netherlands. So I think it's a reason for concern, mostly because in the collective memory, politicians seem to be a bit lost of what our drug policy is about, and that's a concern.
Yeah. Yeah, absolutely. No, thank you. And yeah, you mentioned the services. I mean, I think Eberhard Schatz also responded in the chat to say that according to Correlations research, you know, we've actually seen some positive responses in terms of services, which has been great to see. Pavel, from your side in the Czech Republic, have you kind of seen, has there been much change there in terms of the policy discussions and, you know, the Czech model, so to speak?
Well, Jamie, in fact, not really, because probably as everybody else around the globe, we are so overwhelmed actually by so many challenges just to keep the services going, to keep them open actually, especially those labeled as a harm reduction, low threshold services, all services delivered to most endangered population, people without homes, street drug users. Simply, COVID is generating the atmosphere when many of these services cannot be delivered at the ground. So it pushes us also to spend more money on prevention, etc., just to cut some services, because simply from the epidemiological perspective, we cannot care that at the same time to keep the preventive measures in place. So it's really hard to answer. I think it's too early. We are too much overwhelmed. We see a lack of the funds. We see that some of the services are simply lacking the funds to survive the end of the year. But in half an hour, actually, or in 1 hour, we have the governmental commission directed by the Prime Minister, and one of these key aspects of the debate will be related to the question how to protect services, and at the same time how to fulfill the obligatory preventive measures, at the same time how to survive from the fiscal financial perspective. But I'm afraid that many of these changes will slowly become the permanent reality, and that at the end we will be confronted, even in the Czech Republic, with troubles.
Okay, I appreciate it. Thank you, Pavel. Thank you. Eliza, from your perspective, I guess both talking about Lithuania, but also, you know, the region as a whole as well. I mean, what would you have to add around, you know, the impact of COVID?
Yeah, so basically what I wanted to share is about maybe region, because we as Eurasian Harm Reduction Association working also in other 28 countries besides Lithuania, and when we were doing a research about new psychoactive substances in Kyrgyzstan, Kazakhstan, we also were doing interviews with law enforcement representatives, and it was like very interesting insights from their side about COVID and how actually lockdown of the country affects changes in the drug scene, in the drug policy. Because basically when the Kyrgyzstan went on the lockdown, then law enforcement saw that more laboratories which are making, you know, like, cooking, doing new psychoactive substances, they opened and started to produce new psychoactive substances inside the country. Before, new psychoactive substances were traveling from China, from other countries, or even from Afghanistan. Opioids were traveling to Kyrgyzstan, but when the country closed, of course, it was much harder to bring some substances transitioning. So then loads of new laboratories with new psychoactive substances opened, and as probably most of the attendees and participants knows, NPS have like really loads of risks and consequences for people, and unknown actually consequences and risks. So the drug market of NPS kind of started to grow up in Kyrgyzstan just because of lockdown. And at the same time, the problem in the health and maybe like harm reduction as well services is that there is no responses to it. Like nobody, like people have very less information, not that much information about what to do, how to help these people. Even, you know, when we were speaking about overdoses, how to respond to the overdoses in the countries, doctors didn't know what are the symptoms of overdoses, which is like a little bit, you know, like strange. So even the medical personnel doesn't know like how to react. Then what we should say about like community, you know, like who's learning like from the professionals and experts. So so yeah, I would say that COVID itself, like in the let's say Russian-speaking region, affected mainly not only like health services and harm reduction services, because they were also closing and some people couldn't even get methadone, etc. But also the it was, yeah, kind of like I know a good moment to start create NPS market inside the country, you know. So that's also a big challenge will be for the countries what to do now.
Okay, no, thank you. And Zanat, from your perspective on this question of COVID?
Yes, thank you very much. In terms of when COVID started, of course, we did some advocacy efforts to I would say highlight these measures, alternative and amnesty measures for people who use drugs, for drug-related offenses. On the practical way, it's we don't have any results, but I would like just to say that in Ukraine there is a project of the law about the amnesty of these prisoners due to COVID for minor offenses, and but for this amnesty, and I think on this special category of prisoners will be considered. This is already old with the old age prison women and disabled people. That's it. Related Belarus, there were amnesty, but it's not related to COVID. But currently, I think the country is considering the changes at the criminal law there. And I know that the Minister of Internal Affairs already provided some recommendation to make this all this criminal procedure for particularly for drug-related crimes not so repressive. In terms of also related to COVID, we've done, as probably Eurasian harm reduction, but we've done with the analyst who from Darknet, drug start person, and we actually supported this this survey for Eastern Europe, Central Asian countries, which actually provide us very interesting results about the, as Elisa mentioned, local production of the new psychoactive substances in the country, or stimulants like Kazakhstan, like Ukraine, which actually exporting these to neighboring countries. At the same time, the purpose of our research was to find out what is the particular substances are popular, are demanded in the country, and what kind of channels do they use to get this, because our work on new psychoactive substances actually in light of COVID situation to provide the online or web outreach services for people who use drugs, and also to equip with the skills for service providers how to provide these services. Sorry for this. Yeah, and also to develop some team of doctors who could provide this online consultation services related to new psychoactive substances and stimulant drug use. That's it. Thank you.
Thank you, Zanat. And actually, there's another question while we have you. There's another question for you. It's been submitted by Konstantin. You may have been referring to this because this might be what you're referring to around Belarus, but it says here in Ukraine and Belarus, there was a regulation preventing prisoners of drug-related crimes, preventing them from getting a chance of amnesty. Do you know if this is still in place?
As I said, there was no amnesty, it's practicing amnesty for drug-related crimes in Ukraine currently. I haven't heard this, despite we are working on this with the Minister of Justice and Minister of Internal Affairs. In Belarus, as I mentioned already, there is ongoing process of revision of drug policy and also the criminal code. there. So the new development will be there, and I think it is particularly will concern the people who use drugs and all these offenses related to drugs.
Okay, thanks very much, Nana. Another question, and again, I think this is more broadly to all of you on the panel. This is from the UK, it's from Matt Southwell. So in the UK, the greatest opportunity seems to be coming from our relatively new political appointees, the local police and crime commissioners. They supervise the chief police officer in a local region and they set the local strategy. Some police and crime commissioners have decided to decriminalise or to effectively decriminalise in their regions and to support harm reduction measures such as drug consumption rooms. What do the panel see as the opportunity to engage police leaders in this way and other policymakers to change the policing priorities as a way to decriminalise drugs? I don't know who wants to take that one first. Maybe, I don't know if Zanet, if you want to comment, because obviously you do a lot of work with law enforcement, you know, comment on how we can better engage with them, what the opportunities are to make them advocates for decriminalisation.
Thank you, Matt. Very good question. It was discussed thoroughly during our focus group discussion. I think develop the platform of regular and sustainable approach which involve law enforcement justice sector in this. Sensitizing exercise is always mentioned as a very crucial moment. Development of this partnership through engagement of civil society organization, key population group in the capacity building events, it's really important. The revision of the internal police policy in terms of related to the attestation and changing the indicators of the effectiveness of their work, it's also mentioned there and actually considered very thoroughly by us. So, any other proposals from you, Matt? So we will be working on this area very much, and I think our working group on civil society and UNODC would be very helpful for me just to develop the next step on this, how to make the law enforcement becoming the meaningful partner in the AIDS response in each of the countries. It would be very important. Thank you.
Sorry. Thank you very much, Zanad. Pavel, if I can come to you on that one, because obviously as a mayor, a local mayor, and Prague was pioneering so much of this response, in recent years. Like, what do you think that energy can better be channeled at trying to get this local change rather than trying to make change a national thing?
I think both is absolutely inevitable. But if you take seriously in account the obstructions, in fact, slowing down or even breaking any chance opportunity for respectful dialogue and debate between the national officials, politicians, law enforcement people on such an important topics for us, like, for example, human rights and decriminalization is concerned, about any possible small steps towards more human drug policies in many countries. If we see how difficult that is, I definitely suggest and facilitate in any place where I can the mobilization of the local communities, local authorities, municipal leaders and players, certainly mayors of big cities, Even the Global Commission is just now working on the paper on drugs and the role of the municipal and urban leaders. So definitely, if we cannot just make and challenge and catalyze the change at the national level, we simply have to do it at the city level. And even it's legitimate because the cities are in touch with people in need, with drug users, not the politicians in the members in the parliament or sitting in the governmental chairs. And I am not using these terms in the criticism of those, because I was sitting as a member of parliament many years in the Czech parliament, and I was just also sitting in all the governmental commission meetings related to drug problems. So yes, this is a great challenge to invest in cities' drug policy reforms.
Thank you, Pavel. Thank you very much. And so just before we finish, there's we have a couple of questions which are actually for Erkin in Kyrgyzstan, which hopefully the translators can support us with. And Erkin, hopefully you're back with us. There's a question about new psychoactive substances in Kyrgyzstan and what expertise there is within the system to analyze these substances. So if someone is being processed through the administrative non-criminal procedure, is there enough time and capacity to actually analyze the substance and the amount of substance and the strength of the substance that they have? And another question on the Kyrgyzstan model, which you presented, is around the fact that people can go to prison for not paying the fines. Has this actually resulted in more people going to prison since decriminalization was put in place? Erkin, are you with us? Are you there?
Да, Джейми, я с вами. Спасибо за вопрос. Вот. Ну, аналитика, в первую очередь у нас ведутся это организациями, которые непосредственно работают с ключевыми группами. Вот. Конечно, мониторинг, он ведется вот, по этим делам, и результаты, конечно, очень печальные, так как я уже отметил, многие не могут выплатить штраф, вот, и суды просто-напросто меняют им меру наказания, да, которая ранее предусматривалась в виде штрафа, на лишение свободы. Вот. Также мониторинг показал то, что даже в самом суде лица, употребляющие наркотики, они просят не назначать им штраф. Вот. Так как они сразу говорят, мы не сможем выплатить, вот, лучше сразу нам назначьте меру наказания. Вот. Чем скорее мы сядем, чем скорее мы выйдем. Вот.
Okay. Okay, thank you. And on the question of the new psychoactive substances and whether there's capacity to analyze those.
Ну, насчет нашего потенциала, это занимаются у нас государственные органы. Вот. Есть у нас лаборатории, которые занимаются непосредственно исследованиями. Вот. Но на этот вопрос я, к сожалению, не смогу полностью дать исчерпывающего ответа. Вот. Так как все-таки с каждым днем появляются все новые виды наркотических средств, вот, и насколько наше правительство готово, я, к сожалению, не смогу ответить на этот вопрос.
Many thanks, Erkin. And Eliza, did you want to add to this, Eliza?
Yes, I just would like to add some information regarding this expertise, because we also, when we were doing the research on NPS in Kyrgyzstan, we were speaking about this laboratory, which is checking the substances. And basically, laboratory itself, it exists. However, there were like 2 people who were sent to be trained like how to work there, etc. But then basically when they came back to Kyrgyzstan and when they were asked to start work, they said that the salaries are too small. So as far as I am informed, they didn't start the work. So that's why it's interesting, because some people say that the laboratory is working and substance can be checked, and some say that it's not working. So then the question is like, so how they are checking, who is checking, like taking a bag and then just thinking, okay, 20% of this substance and 30 of this. Like, I'm not sure actually about how it's working now in Kyrgyzstan, but a few months ago, it seemed that laboratory was not working. Like it exists, but it doesn't have capacities to work, like human resources, basically.
Okay, thank you very much. Okay, well, I think that kind of brings us towards the conclusion of the session. So thank you so much to everyone for joining us. And in particular, thank you to all of our speakers for letting us understand a bit more about the situation in your countries, and you know, for some of the work that's going on towards decriminalisation. And I think it's clear that we still have a long way to go, you know, to really get this right and to really get the policies that we would love to see in place, policies that protect and look after people who use drugs rather than punish them. Thanks also to the Correlation European Harm Reduction Network for hosting the whole series of events today, in lieu of the planned conference that was supposed to be in Prague. And obviously, thank you so much to the Eurasian Harm Reduction Association, to Anna, to Eliza, to Alina, to other colleagues there for putting this session together and bringing together these speakers and having this conversation. So I think all that leaves me to say is to wish you all a happy remainder of the week. Stay safe, and remember, support, don't punish. Thank you, everyone.
Thanks.